Guys, we are back again talking today about quad tension. So a problem that can create a number of secondary issues when we've got a whole lot of high tone in the quads, really high threshold muscle that's giving us a lot of grief. The most obvious symptom will be knee pain. Lateral quad gets tight, it's patellofemoral symptoms. Other one we might see is anterior hip pain, clicking, popping, pinching. We think rec fem gets a bit tight. It's going to pull that femoral head a bit forward into the acetabular socket, causing it to nip and pinch, particularly when you go from a hip flexed to hip extended position. Those are two symptoms. The third symptom we might see from tight quads is you have no ass. So if you've got no butt, it probably tells me that your quads are doing a lot of your lower limb work for you and you're not using your glutes. So we have to start to think a little bit laterally about this problem. When we see quad tension, we want to think, is the quad turning on more to compensate for weakness, maybe at the foot, maybe up at the hip? So it's doing more than it should to try and compensate for a downstream or upstream weakness. So something that was brought to my attention by a colleague, so shout outs to Powerful Atlanta Churcher, thank you for this insight. She was looking at my creaky knee, asked me to squat and said, hey Mike, you're squatting on half a foot. So if we examine the foot as an example, particularly as a problem of downstream weakness causing the thigh muscles to compensate, we typically have our 3 foot arches. So we've got our arch at the top and 2 lateral arches that basically form this triangle of stability. Now, if I'm aggressively flaring my knees in a squat like I should, I'm getting that lateral rotation component, what we can see is that arch actually lift up. Now, I should be able to keep a neutral foot. I should be able to keep that arch consistent in spite of my knee angle. But what you'll notice is that as I flare my knee out, that medial arch wants to pick up. Now the effect that has, we can see, is that I've got this triangular base of stability. All of a sudden, I take away one end or 2 points, and all of a sudden all I'm left with is that one line of stability. So I've gotten rid of 2/3 of the stability in that system. Now that is enough to make any muscle kick into absolute overdrive. So if you've got 3 points of contact on a tripod, you take two of those legs away, what happens? That's going to collapse. So all of a sudden, all these support structures up and downstream from the foot kick into overdrive, trying to do the job of a foot. So check your barefoot squat. Check yourself in single leg stance, left and right, or have someone look at it for you. Now the other thing we talked about is having no ass. Do you have glute function? Again, this is something that's going to pop up when you go into a single leg stance. So if I'm doing some type of single leg activity and you look at me on one leg versus the other, if I do a single leg squat on one side and my hip shoots out to the side like that, we call that a Trendelenburg when we're walking, that tells me my ass isn't working on that side. Particularly if we know we go to the other side, which might be your non-painful knee, and you can keep nice and vertical in that line versus having that hip shoot out on the opposite side, we know we've got a glute weakness problem. So there are 2 things immediately to look at when you've got chronically tight quads. Now, wouldn't be much help if I didn't show you something at least to kind of address the tight quads. So I'll show you another souped up version of the couch stretch that I've been playing around with. But the main take home here today, guys and girls, is if you've got quad tension, knee pain, check your foot, check your butt, okay? But here is the couch stretch I've been playing around with. So one of the problems we also see with any type of soft tissue work, any type of mobility practice, lacrosse balls, yoga, the novelty will wear out. If you do the same stretch time and time again, your body says, oh, we know what that is, we're not going to adapt to that anymore. So there needs to be novelty in your stretching. Here's the one I've been playing around with a couch stretch. So get into the same position, knee into wall, coming up. Now I actually find this one a little bit better than doing it on a couch because my knee won't slide forward when I've got it pinned back. Similarly, my ankle can't dorsiflex over the cushion, so I keep it pinned in more. I'm going as upright as I can. I'm going to toss that overhead. I'm going to see if I can get that elbow up, and I'm going to tilt slightly away. This is absolutely awful, but really effective. 2 minutes each side. That will get your quad. Added bonus, that upright side flexion will get a little bit of your psoas too. Fantastic one for loosening off tension. But again, take home guys, if you're squatting and you've got knee pain, check your foot, check your butt. That should give you some direction where to go. If we're thinking, hey, I've got no foot control, we need to get that arch down a bit. We need to loosen off that tib post. Maybe get in on the inside of that shin. Dig in through there. Do some circles. Do your work. Fire up your glutes. Get a band around there. Do some abduction. Pop on your side. Do some clamshells. Pick your poison there, guys. But just know how to assess your weakness. Take care.